Hi, I'm Dr. Joel Cherdack, President of Denver Regenerative Medicine. And today I'm going to answer most of the frequently asked questions regarding our stem cell therapy procedure. So, our stem cell therapy procedure takes approximately 3 hours and it's performed in an outpatient setting in our outpatient clinic. The first thing that happens when you come in for the procedure is we're going to take a routine laboratory blood draw. So very similarly to if you're getting a regular blood test, we take a small sample of blood and we take that sample of blood and we put it in a centrifuge and we allow gravity to separate that sample of blood into its different elements. And then we're able to extract just the platelets out of that sample. So then we have the isolated sample of platelets. While those platelets are being processed, we have our patients laying face down on our procedure table. And then what we do is we numb up the area around the bone that you feel that sticks out of the back of your hip in your lower back. And we numb that whole area up and we take a very thin needle and we go just below the surface of the bone and extract a very small sample of bone marrow. And very similarly to how we process the blood, we take the bone marrow and we put that in a centrifuge and we allow gravity to separate that bone marrow sample into its different elements so that we can extract just the stem cells out of that bone marrow sample. And that bone marrow sample contains millions and millions of adult stem cells. Then the last place that we obtain stem cells is from abdominal fat. So what we do then is we have our patients laying face up on our procedure table. We make about a 1 square inch area of numb abdominal skin. We use lidocaine. And then we take a mini liposuction wand and we go into the side of the abdomen and we inject anesthetic fluid and pull out about a shot glass full of fat. So we take that shot glass full of fat and similarly to how we process the platelets in the bone marrow sample, we put that shot glass full of fat into a centrifuge and allow gravity to separate that fat sample into its different elements so that we can extract just the stem cells out of that fat sample. So the stem cells from the fat sample and the stem cells from the bone marrow, while they're both adult stem cells, have a little bit different function and a little bit different of characteristics. So when you combine them together with the platelets, you get a very strong healing effect. So then we take both stem cell samples, the one that we get from fat and the one we get from bone marrow, and we combine that with the platelets in one syringe. And then using ultrasound, which is like an up-close MRI, the same technology that they use to look at a fetus in the womb, we use to look at the internal structures of whichever area of the body that we're treating. So for example, if we're treating the knee, we use the ultrasound to see internally inside of the knee. So then we take the syringe and we inject the entire joint or the entire area that we're treating, and using the ultrasound we can make sure that we're addressing any of the damaged tissue, whether it's degenerative cartilage or whether it's a torn ligament or a torn tendon or a torn muscle. We can visualize that stem cell and platelet combination of cells and the injectate going directly into that area so that we know that we're hitting all of the damaged targets. After we complete the procedure, what I tell patients is if you walk into our clinic, you're going to walk out. There's no downtime per se. We're not going to immobilize the joint. There's not going to be significant restrictions like you would have in a surgery. There may be some light restrictions, but it would be nothing comparable to having a surgical procedure and recovering from that. So after the procedure, like I said, if you walk into our clinic, you're going to walk out. It takes approximately 4 to 5 weeks for those cells to accomplish the goal of healing and creating new tissue. So it's approximately 4 to 5 weeks before patients are reporting a significant improvement in their condition. So we reevaluate our patients at 4 weeks, and at that point in time, almost all of our patients are doing significantly better. The stem cells will continue to work and they'll continue to have their healing effect for 3 to 4 months. So our patients will continue to experience improvements in their condition for that period of time. At the end of that period of time is when our patients have reached their maximum benefit. So for some of our patients, that's going to be 100% pain-free, 100% return to function with no restrictions in range of motion. For other patients, there's going to be less of a result than that. A lot of it depends upon how bad the injury or how bad the degenerative arthritis was at the time that we treat the patient. But what we do is during our consultation, our surgeon, our provider, lets the patient know whether or not they're a good candidate, first of all, and what we believe the expected outcome will be. We meet or exceed that expected outcome 90% of the time. So that's better than any surgical outcome. And that's what I refer to as our patient satisfaction or our success rate. Oftentimes patients ask me what our success rate is, and I describe it that way for them. As far as how long these procedures last, we've been doing these procedures. We are now going on our 11th year, and we have not had situations where patients are returning because the procedures are wearing off. More often, we're having patients who are repeat customers, but they are so because they then have another area of the body that they need to have treated, and they had such a good result with the initial area retreated that they're interested in then moving on to another area. This is particularly the case with degenerative arthritis, because degenerative arthritis happens throughout the body at different times. That answers most of the questions that patients ask regarding our stem cell therapy procedures. If you have any additional questions, please feel free to email us or to call us on our number listed online.